Okay. We have 2 minutes left.
Yeah,
sorry.
sounds good.
Okay.
Hi, Carly.
Hi, Brittany.
I wanted to thank you for coming in to see me today.
Yeah.
And before we start talking about what's going on, I just kind of wanted to give you a preface of the theory that I'm going to be using. So it's called behavioral therapy, and basically what we do in this therapeutic technique is we try to kind of dissect and analyze your problem, thinking about like all of the antecedents that precede the problem, what ends up happening with it, and some of those consequences. So we're kind of going to follow that pattern if we can, if it applies to your situation, and maybe kind of piece it apart and see if we can do anything with it.
Nice.
All right, does that sound good?
Yeah.
Okay, cool. So with that in mind, tell me what brings you in today.
Yeah. I've just been probably in the last 2 to 4 months not been sleeping as well. Like, you know, I find myself just not getting the quality sleep that I need, and then I feel tired the next day. And it's just unpredictable, I guess, with my like bedtime and wake up time.
Yeah. So you said this has been going on for the past 2 to 4 months?
Yes.
Was there anything that was going on at the time that you started noticing this happening?
Well, my husband and I did move in with my parents.
Oh, okay.
Back in March, so
okay.
I think that could be when it started.
Okay, so since moving back in with your parents, you feel like you're not sleeping as well?
Yeah.
Okay. So do you and your husband, I'm sure, have your own room, own section of the house? Yeah.
Yeah.
Okay.
Yeah, my parents live in a ranch, so and then we just kind of have a room down in the basement.
Okay. And you said that you've especially noticed the problem getting worse recently. Has anything happened recently?
No, nothing recently. I think maybe just like stress with school and having to stay up late, maybe more with assignments or.
Okay.
Yeah, and then I started just training too or I didn't just start, but I've been really trying to keep up too with like my running because I'm gonna run a half marathon in August. So.
Oh, wonderful.
That with kind of knowing like, oh, I need to run in the morning or getting my workout in, so then I don't have to do it later at night.
Gotcha. So that you can, fall asleep and be peaceful.
Yeah, definitely.
So what does a typical bedtime routine look like for you?
Yeah, so, I mean, typically I'll just, at night be studying, like, upstairs on the main level, doing homework or such, and then I'll take our dog out and my parents' dog, and then I'll go downstairs, like, go through my bathroom routine that I do, and then I'll lay down. This is probably about, like, usually between 9 and 10, like, that hour range, and then my husband always stays up later, so sometimes he'll just like lay with me and we'll talk a bit. And then sometimes when he leaves, I do find myself like going on my phone. So.
Okay, so thinking about that for a moment, how long would you say you're usually spending on your phone at night?
I'd say, like in bed?
Yeah. I'd
say probably like 20-ish minutes, give or take.
Okay.
So some nights it might be longer.
Okay.
And it's like there's no meaning to it either, It's just like meaninglessly scrolling and like looking at Instagram or Facebook, and so it's not like there's a purpose to it or so. But it's definitely, I think, created a habit that whereas like when we were at our apartment still, I charged my phone like in the kitchen, so a different side of the bed. But then I should also note that part of the reason too I charge my phone by my nightstand now is like I have to, sometimes our alarm will go off at like 4:30 that and I feel bad if my husband takes our dog out every morning right away.
Oh, okay.
So it's like,
is that what the alarm is for?
Yeah, or like, and just to kind of get up and start the day. So it's like I'll set my alarm for 10 minutes sooner, so I can get up. So so yeah, that like in the morning too.
Okay, so you're almost setting the phone there for a couple reasons. One, to charge it at night, and two, because you feel guilty that, if your husband would wake up first in the morning to take out your dog, that
definitely
he would be responsible for that.
Yeah.
So it's almost like you're proactively setting it there so that you can stop the alarm right away so he won't wake up. Okay. Okay, so you're being kind in a way.
Yeah.
To your husband. Would you say that you're on your phone every night before bed?
Yeah, I'd say it's very rare that like I just fall asleep.
Okay.
Sometimes if I am tired enough, when my husband like leaves the bedroom to go, work, because he does stay up like a few hours past the time I do, then I find just like sometimes if I'm really tired, then I'll fall right asleep.
Okay.
So.
Okay. And you said the purpose of being on your phone is kind of meaningless to you. So it's like mindless scrolling through Facebook or whatever.
Yeah, it almost seems like to like check like whatever I would have missed, in the past like hour or two.
Okay, so it does have a purpose, but not necessarily a productive one.
Yeah, no, definitely. I'd say not productive.
Okay, so then what would it be like for you if you decided to charge your phone somewhere else and not have it right by the bed?
I've thought about that, but then there's almost like a little anxiety because then I'm like, oh, then my husband's going to have to wake up and do the alarm right away, so I don't know.
So you don't really see a way around that?
No, I mean,
maybe
I could. And he says he doesn't mind. That's the thing. But
okay. So then it sounds like maybe this is almost a self-created problem.
Yeah.
Okay. And I'm just curious, I don't know how heavy of a sleeper you are, but if you maybe put the phone on vibrate, would that still wake you up and not disturb your husband?
Potentially. Yeah. But I think the act, too, of like completely not having the temptation would be good.
Okay, yeah, so just
next to me,
displacing it entirely.
Like just a different outlet, like even in the hallway or like a different corner of our bedroom.
Okay, I mean, and that's certainly one thing you could try. Another thing, if you feel like the phone is keeping you up at night, have you ever tried falling asleep just reading a book?
I have sometimes.
Okay,
but yeah, only a few times.
Only a few times. Okay, so maybe that's not the right outlet for you.
No, and I'm pretty fast, like once it is dark and stuff, that I can fall asleep pretty quickly. But a book too does help at times.
Okay, so that's maybe another alternative you could try.
Yeah.
And so we've talked a lot about the antecedents to you falling asleep, the behavior of staying up late. What are some of the consequences of not getting enough sleep each night?
Oh, I definitely find myself just more irritable in general the next day. And just, feeling more tired. And then it's easier, to like, oh, I'm not going to go for a run right now. Like, I'll take our dog out and then just like, maybe fall asleep a little on the couch before I have to get ready for the day. So, and then I just find myself too, it's like harder I nanny during the day, so the little boy I nanny, like during his nap times, I find like even myself wanting to like find some time to take a nap, like it's easier to, and he's getting active now, he's almost 1, so he's like, I find myself tired that I can't like use his nap times as being productive if I didn't sleep well the night before.
Yeah, so I hear you saying there's kind of a lot of downsides to not getting enough sleep every night. Just overwhelmingly you're tired and you don't necessarily have the energy to do the things that you need to do during the day. You said sometimes you're skipping out on the runs in the morning, which is important for you to keep up on because you're going to be doing that half marathon. You have less energy throughout the day, and sometimes it affects, you nannying later on, along with just the rest of the day, your productivity. So what would be some of the benefits of getting more quality sleep at night?
Definitely having, a more productive day and getting everything accomplished that I set forth for the day, like in terms of with school and working out. And I think I just am in a better mood with, my family, my husband. There's less irritability, obviously.
Right. Do you feel like that irritability ever drives behaviors or conversations you don't necessarily want to have with your family?
At times. I think more just my response is just quick, that I'm not.
Okay, thanks.
My response is just quick, that I don't necessarily think what comes to mind. It's just more of a reaction.
Okay. And how does that make you feel when that happens?
It creates like guilt, especially with my husband, if I'm not, thinking necessarily before I process what I'm saying, or just basing the decision off emotional circumstance.
And obviously when you're not getting quality sleep, you will feel a lot more emotional, and you'll feel guilty, as you said, about some of the things that happen that you don't necessarily have as much control over as if you would have gotten a good night's sleep.
Yeah.
Yeah. So do you think that in addition to some of the things we talked about before with the interventions with your phone, that you could maybe set aside a little bit of time during the day to not be productive, to maybe take a nap, or try to catch up on some of that sleep that you're missing?
Yeah, almost cut that time out of the day.
Yeah, just to maybe set aside a little bit of it if you feel that it would help you.
Yeah, that might definitely help.
Mm-hmm.
I could try that.
Yeah. And, making sure that you're in an environment where it's acceptable to do so. And all that might help you feel a little more productive and just better about your situation.
Yeah, thank you.
Yeah, no problem. So maybe we can take a look at that again next week after you've tried some of those things we talked about?
Sounds good.
Okay, cool.
Thanks.
Thank you.
All right. Yeah, I felt like you asked really good questions.
Yeah.
And just get to what was going on.
Okay.
And explore. It seemed like you were really trying to kind of cover all the bases, to see where are you sleeping? Not do you share the same room and what's happening? Yeah.
Just because the environment can impact it so much.
Yeah.
And I like how you thought, or you were doing the consequences of not getting a full night's sleep, and then how do you feel what would be some that are the positives of getting a full night's sleep?
Mm-hmm.
That was
just to kind of reinforce.
Yeah. And then brought up those themes of irritability and being less productive and
the negative ways that it impacts you that you don't want.
Mm-hmm.
Yeah.
Yeah, it's good.
All right. Anything else?
No. Well, and then just exploring interventions too.
Okay.
Or bringing up different things that you could try out. I thought that was really good too.
Okay.
Yeah. Cool.
I was gonna say one of the things I don't know exactly if Bill covered this because I didn't see him do it in his little role play in the front of the class.
Mm-hmm.
But one of the things that I think is really important is try to give the client some ability to make their own. Next time I'm going to try this.
Okay.
Try to get that just because it helps them reinforce you know what I mean? If it's somebody else's idea, it's good, but when it's my idea, it's great.
Yeah.
You know what I mean?
Yeah.
So getting
They're more
that
likely to do it.
exactly
Yeah.
because and then it's almost like they've made a contract with themselves.
Right.
I'm going to do this next week, so it's more about them than it is about you. If I give you something to do, it might be a great idea, but I give you something to do, and then they don't come in next time, then they're like, I didn't do what you told me to. That's how they come back. It's I didn't do it, and it's just wait a minute. It's not. I wasn't telling you. I was giving you right. You get what I'm saying?
Yeah.
And so it just kind of opens that up for them. So
a little more.
Just is there anything? Yeah. But I think your questions were great. You did a really good job questioning. You're very calm.
Mm-hmm.
So it doesn't feel judgy or prying or you're in there to I'm gonna extract everything I can. It feels very inviting and calm, and I think that's really good with this theory. That you come across very, because when we're asking a lot of those, but where are you sleeping and who are you? That stuff can get very okay,
kind of invasive.
I feel like
You're
I'm
so
on a
nosy.
stand and you're asking me what? Yeah, exactly.
Right.
So, but I didn't feel that. How did you feel?
Yeah, no, I felt very understood and felt calming too. And you drew up things that I wasn't aware of too. I thought even just in the short time together.
Yeah, that's great.
All right. Awesome. Good job. Thanks.
Right. Have you guys all gone?
Yeah.
Okay.